Let's move on to the next thing, that is mechanics of respiration, the most important thing over here. Please remember, here one law is applicable, that is Boyle's law. Boyle's law says that when you keep the temperature constant, the PV is equal to be constant. That means the pressure is inversely proportional to the volume. You increase the volume, pressure will be decreased. You decrease the volume, pressure will be increased, right? And please remember, there are two phases in the respiratory system, that is inspiration and expiration. Inspiration, when we talk about it, it is the suction pressure. Inspiration, S for S. Please remember, during the inspiration, always ITP, IAP, everything is going to be negative. Intra pressures are going to be more negative. In case of expiratory system, they will be more positive. With that, let's move on. What are the muscles that are going to be used? One question. Please remember that during inspiration, diaphragm and external intercostal is going to help me out. Always remember, in the respiratory system, in goes with X and X goes with in. That means for the normal quiet inspiration, external intercostal is going to help. And how much? Diaphragm has more contribution as compared to the external intercostal muscle, but they are important, right? If I talk about quiet expiration, we don't have to do anything. Just relax whatever muscle was constricted during the inspiration. So see over here, what is going to happen during the inspiration? When the diaphragm is going to constrict or contract, what is going to happen? This is the normal diaphragm, you can say, in the resting condition, and as soon as it contracts, it goes down, right? It is going to go down. So this is normal, this is contraction. So vertical diameter is going to increase. When the external intercostal, they are going to contract, what will happen? My rib cage is going to move outward. So transverse diameter is going to increase. The rib cage is also going to move forward and you can say a little bit upward. So that's why the anterior-posterior diameter is also going to increase. So all the thoracic diameters, they are going to increase. So overall thoracic volume is going to increase. If I say that the thoracic volumes have been increased, what will happen to the pressure? Volume increase, pressure is going to decrease. If I have lower pressure inside my lung as compared to atmosphere, the inspiration will occur. That means the air entry is going to take place. Exactly opposite happens to the air in the expiratory phase. You are just going to relax whatever muscles you have contracted. First of all, let's talk about the external intercostal muscle. They are going to come back to their normal position. So we are compressing the alveoli, right? Plus the diaphragm also going to come up. So again, we are compressing the thorax. So positive pressure will build up. You don't have to contract any muscle during the normal quiet expiration. It is the passive process because of the recoil property of the alveoli. Alright, but during the forceful inspiration, with the diaphragm and external intercostal, some extra muscles are required to be contracted. And what are those? Those are nothing but the SCM, that is the sternocleidomastoid muscle, and the scalene muscle. They are going to further increase the vertical diameter and further increase the inspiration, further decrease the pressure, right? And if I talk about forceful expiration, then your abdominal muscle must be contracted. With the help of that, we can push the air with the more force. That is nothing but rectus abdominis, internal intercostal, and transverse abdominis. The internal intercostal is also going to help us out to push the air outside. Coming to the quiet breathing, if I talk about two pressures, intra-alveolar pressure and intrathoracic pressure. Please remember, intra-alveolar pressure, in that A is coming, A is the first alphabet. So please remember, during inspiration and during expiration, the pressure is going to change by 1 mmHg. Only 1 mmHg, especially in the quiet respiration. So how much it is going to change? Inspiration may it is going to change by -1 and expiration may it is going to change by +1. It will be -1 mmHg and +1 mmHg. Please remember, if they ask about at the end or at the beginning of any of the phase, the pressure is going to be 0. What I mean by that, see over here, this is the diagram of inspiration and expiration. That means intra-alveolar pressure. See over here, at the beginning of inspiration, at the end of inspiration, which is the beginning of expiration, and at the end of expiration, all the pressures are going to be 0, 0, 0. Why? Because it is directly in contact with the atmosphere. It is the open system. And if I talk about the intrathoracic pressure, it is the closed system. We'll come on to that later. So see, during, just whenever we are going to contract the muscle, it is going to change. That is, during the inspiration, it is going to be -1. During the expiration, it is going to be +1. If they ask at the end, beginning of inspiration, expiration, it is going to be 0. Now, coming to the ITP, ITP is a closed system because both of the pleura, they are going to be merged with each other at the level of hilum. So, they are acting as a thermos where they can have any pressure. So, please remember, usually it is negative pressure. During inspiration, it is going to go in more negativity, that is -6 mmHg. Normally, T for 2, please remember, normally it is -2.5 mmHg, and during inspiration also it is going to go in the more negativity, same as intra-alveolar pressure, go in the more negativity, and during expiration it is going to go back towards the -2.5. So please remember, this is the graph which is showing the intrathoracic pressure, which is also known as intrapleural pressure, intra-alveolar pressure, which is also known as intrapulmonary pressure, but you'll get confused between P and P, so that's why I have written as IAP and ITP. See over here that this is the pressure, -2.5. When the person is inspiring, it is going to go towards the -6, and during expiration, it is going to come back. Alright. And we talk about the volume. When the pressure is decreasing, volume is increasing. Boyle's law. And when the pressure is increasing, the volume is decreasing against the Boyle's law. And this volume is 0.5 liters. That means 500 ml. That is nothing but the tidal volume. Let's come on to the ITP. Why it is negative? Because I told you that if I draw the alveoli over here, this is going to be, in this, I'm going to have this intra-alveolar pressure, intra-alveolar pressure. This is finally connected to the atmosphere, which is called as open system. But if you look at the pleura, so see, this is the pleura which is merged at the hilum, and that's why this is not connected with the atmosphere, and that's why it is the closed system. And one pleura is attached to the lung, one pleura is attached to the thoracic cavity. The normal tendency of lung is to recoil inward, and normal tendency of thoracic chest wall is to spring out. And because of this opposite recoil, what will happen? In between, the vacuum-like space is created, that is nothing but negative suction pressure is going to be generated. So please remember that it is because of the opposite recoil we do have negative intrathoracic pressure even at rest. Now, how to calculate trans pressure? We talked about intra pressure, intra-alveolar pressure or intrathoracic pressure. Let's talk about the transpulmonary pressure, transthoracic pressure. What you have to do? You have to do two things. What are the two things you have to do? First thing, check what is the innermost layer of it. Let's say I talked about the transpulmonary. Pulmo means lung. What is there inside it and what is just outside it? Adjacent layer you have to identify and do in minus out. For example, intrapulmonary. Pulmo means lung. Inside the lung I am going to have intra-alveolar pressure. Outside the lung I am going to have pleura, that is nothing but thorax. So intrathoracic pressure, in minus out, IAP minus ITP, which is going to give me the transpulmonary pressure. If I calculate the IAP and ITP, let's talk about during inspiration. Why during inspiration? Because during inspiration it is more negative. That's why I'm choosing more negative pressures to show you something. What is it? IAP is going to be -1 and ITP is going to be -6. Right? So how much it will become? -1 plus 6. So that is going to be plus 5 mmHg. So please remember, yes, all the intra pressures are going to be negative, but the TPP, that is the transpulmonary pressure, will never be negative even during the inspiration. Why? Because the ITP is always going to be more negative as compared to IAP. Alright, so please remember that. Let's talk about the transthoracic pressure. Transthoracic, just inside the thorax, I am having the pleura, and just outside the thorax I am having the atmospheric pressure. So in minus out, that will become intrathoracic pressure minus atmospheric pressure. So that will become ITP. Let's take during the inspiration. ITP is more negative, -6, isn't it? And atmospheric pressure is always going to be 0. So please remember, it is equal to ITP only. So it is going to be negative. So it is going to be -6. It can go in the negativity, it can go into the positivity, especially during forceful expiration. It can go up to +20, +30 also. Alright. Transrespiratory pressure. Transrespiratory. In the respiratory, I'm going to take the chest wall also, and I'm going to take the pulmonary, that means lung also. So please remember over here, I'm going to take the innermost layer, that is IAP, and outermost layer, that is atmospheric pressure. I'm going to subtract the atmospheric pressure from the IAP. So how much is the IAP? Let's check during inspiration. It is going to be -1 and atmospheric is going to be 0. So it is going to be -1. It is usually equal to intra-alveolar pressure.